The human being has 2 sets of teeth in their lifetime. The baby, or primary teeth, which are normally 20, and you end up with 32 permanent teeth. Teeth are important to us for several reasons, including helping in chewing food, smiling, beauty, and even keeping the shape of our faces, among others. Teeth are part of what comprises our mouth, where experts like Dr. Judith Nalukwago derive the concept of oral health. Oral hygiene is the practice of keeping your mouth clean and disease-free. It involves brushing and flossing your teeth, as well as visiting your dentist regularly for dental checkups.
Our mouth naturally has bacteria. It's a natural thing for your mouth to have bacteria. It's like the vagina of women has bacteria, which keeps our mouth safe. Unfortunately, that bacteria feeds on the food we also eat as humans. But when it feeds on that food, for it, you know how you eat food, then you go to the toilet and poo-poo. For it poo-poos acid. Now that acid, the bacteria poo-poos, is what destroys the teeth. It's what destroys our gums. So the understanding of that is how you can understand that, oh, this is why I have to brush my teeth to starve the bacteria so that they do not have to produce acid. Yes, because acid is the main issue actually in the mouth.
Oral health is also linked to whole body health. For example, if an infection is present in your mouth, your bloodstream can carry the bacteria to other areas of your body, leading to other health concerns.
I can look through your mouth and I know you have a certain disease. I can look through your mouth and I know you have candidiasis because it also manifests in the mouth. I can look through your mouth and I know you have hypertension. I can know you have diabetes just by looking at your mouth. So a mouth is a manifestation of the whole system.
There are several warning signs that could indicate oral health problems. The most common signs of poor oral hygiene include gum disease, tooth decay, and chronic bad breath, among others.
People who have yellowish things on their teeth, inside and outside. That is what in Uganda they call kabole. Many people in Uganda have kabole, some knowingly, some unknowingly. It has a lot of germs in it that cause gum disease. One of the effects it does is, you know where your gum lines on the teeth. So it also touches that area. That's where it attaches on the teeth. Now when it attaches, it pushes the gum down because you remember it keeps accumulating over time. So it pushes the gum down. So remember when it's pushing the gum down, the tooth is losing support. Then eventually, when it keeps pushing, it will reach that bone level. Then it also starts pushing the bone down. So your tooth will also, that means the bone around the tooth will also start reducing. Eventually, your tooth will start shaking. You'll start feeling sensitivity because your root of the tooth is exposed and it's very sensitive. And then you've had people who say, I was brushing my teeth and then I saw blood from my mouth. It's because the gum is diseased. It is inflamed. In most cases, you find the gum is really inflamed. It's big, it's swollen, and it's reddened. So when a toothbrush touches it like this, it starts bleeding immediately. So many people experience that and they do not know the cause. But
Dr. Nalukwago advises that one should visit a dental clinic at least twice a year for proper checkup.
Because there are areas in your mouth that where the salivary glands are, that's where saliva comes from. Those areas, like I said, have a lot of calcium. So they easily, those areas, calculus, that solidified food can easily attach on the teeth in those areas. That is this side next to the premolars and molars up, and also here, down here next to the tongue, the teeth are next to the tongue. So those areas, even when you clean well, with time the calculus can come. But when you do professional cleaning, that is what they clean away. So Ugandans or anyone out there, you have to know that you have to do professional cleaning every 6 months. But then the other thing, people should learn to eat things like sugarcane. Sugarcane naturally cleans the teeth, by the way. That is why our parents used not to have so much conditions like this. These are just natural things that exist in our environment, but we do not use them. You see, us in Kampala, we don't want to eat sugarcane, but eat it because naturally it's like a toothbrush. And then also, when you see anything, please stop using these very many of the herbal medications. You don't know what they contain, so they can be dangerous to your gum. First, go to a dentist. They identify what is the problem, then they give you a treatment plan. After treating gum disease, by the way, it can heal, and you can go back to normal, and you practice your good oral hygiene.
Oral diseases, while largely preventable, pose a major health burden for many countries and affect people throughout their lifetime, causing pain, discomfort, disfigurement, and even death.
What you have to do is you have to brush before going to bed. Then when you wake up in the morning, you know our parents used to tell us, brush when you wake up. But remember, you haven't eaten anything the whole night. And you brushed before going to bed. So you're supposed to brush after breakfast. Because after breakfast, again, you've put food in your mouth. And that food is going to be in your mouth for a whole day. So you can brush it out after having breakfast and then you move.
It is estimated that oral diseases affect nearly 3.5 billion people across the world. Untreated dental caries or tooth decay in permanent teeth is the most common health condition according to the Global Burden Index. Walter Mwesigye, NTV.